Good morning. My name is Jim Stanger. This is a great little video to answer a question: does flying after embryo transfer impact implantation? So, is it a good idea to mix flying and embryo transfer? Because the paper by this group of Brazilian authors made a comment that with the rise in medical tourism, does flying after embryo transfer impact on your chance of pregnancy? This is actually a really good question. So before I go any further, I need to have my normal welcome and disclaimer. My name's Jim Stanger, for PhD in embryology, and I've been practicing embryology for more than 50 years. These videos from my YouTube channel, are my attempt to bridge the gap between information you may need for your fertility treatment and the most recent publications available to your clinic staff. I'm not a medical person, and this information is not medical advice, but it may help you in knowing what questions to ask about your treatment with your doctor, and maybe to help in understanding the advice that you receive. And always, this page has been allocated to be a potential supporter for IVF Daily. So I'm just starting out, but if you want to promote your company or clinical product, this just may be the place that you can do that. Remember, in supporting Fertidade's IVF Daily channel, your support may mean an IVF client becoming a better informed IVF client, which is the most important thing. You can click subscribe or become a sponsor, or just make a donation to help others on their infertility journey. Okay. So embryo transfer. Thousands of studies have tried to identify individual factors that could interfere with the success of IVF before stimulation and to follow up after the embryo transfer. One of the most critical moments in fertility treatment is embryo transfer, which must be performed per specific management protocols and follow-up guidelines. Most couples are told to rest after transfer, but does it really make a difference? We did a study ages ago looking at intercourse where before and after transfer, one of our nurses was interested in that. And when we looked at all the data, we were surprised how many people had intercourse before and after transfer, and were not at all surprised that it made no difference to the outcome. But most couples are told to rest after transfer, but doesn't make a difference. Although most recommendations indicate that flying is not harmful after embryo transfer, the scarcity of scientific literature on this subject encouraged this study. So the study was carried out in Brazil and retrospectively looked at just over 2,000 transfers. They were divided into two groups: those who presumably travelled by aeroplane because they came from outside the clinic's location, and the remainder that presumably did not travel by plane because they lived locally. So I don't think they specifically asked the clients if they travelled by plane. It was more to do with whether they lived in a location where they needed to travel by plane. They looked at the pregnancy rates and the miscarriage rates, and guess what they found? No difference. So the pregnancy rate in the flying group was 62% compared to the no flying group. And the miscarriage rate, that's miscarriages per pregnancy test, was the same virtually in both groups. 22 and 17% are not significantly different. So this is a great outcome. In other words, they could show there was no difference. There are, however, several potential additional risks to embryos associated with flying. These include the additional activity of movement, including luggage handling, potential changes to the cabin atmosphere. Some people report mild hypoxia, solar radiation, and security scanning, such as whole body scanning. So there is some data to suggest increased miscarriages associated with flying. For instance, flight attendants have a higher miscarriage rate than the background rate. But the American College of O&G states occasionally travel has no known pregnancy risks. There we go. So, is it safe to fly? The authors report they did not find any negative impacts on air travel after embryo transfer. This allows patients to return home after the procedure, and this may reduce stress and treatment costs. And their data shows that patients should be encouraged to return home even by plane. So they concluded a retrospective analysis of just over 2,000 embryo transfer revealed no significant difference in pregnancy, implantation, and miscarriage rates between patients who presumably travelled by airplane after transfer and those who did not. While the study suggests that flying post-transfer is generally safe, It is essential to acknowledge its limitations, including its retrospective nature and lack of control over flight-related variables. Okay, so this actually is a good news story. This is a good example of a study which provides reassurance to clients and clinics that often ask questions which are asked repeatedly and to which there is no known data. These usually mean that there is no impact. In this case, the study has confirmed that. Negative observations such as this can be as important, or probably more important, as a significant difference. So the data at least says it's okay to transfer and to fly. Just to finish up, I'd like to thank you for your attention. IVF is a personal journey that involves the action of many. And it helps to understand all aspects of that journey, and I hope this video does that. If you like more information, if you like the information provided, please tell other clients about the service and please subscribe. Okay, thank you.